So next we have Alan from Sherwood Park asking, when should I get a hair transplant? As long as your hair loss is stable and you've been stabilized with medications, if you do have male pattern hair loss, and there are no other factors which bar you from being a candidate, I think the sooner the better. And the reason for this is if you have areas that need to be transplanted, you want to make sure the native hair is stabilized and the loss of this is deaccelerated. And secondly, by adding more earlier, you're going to require less grafts. Of course, we all may require more grafts as we get older, but from a cost-effective standpoint, I believe that the earlier we get hair transplants, the less grafts you're going to require, the better the results you're going to be, rather than leaving your scalp in a condition whereby you're going to require 5,000 to 8,000 grafts. At this point, we sometimes run into problems where we simply do not have enough donor density in the back to even perform surgery. So this is why I always say the sooner the better. Stabilize your hair loss and add more.